Welcome to CAM-TV, today's latest complementary and alternative medicine station.
This week's edition is on the stimulation of P6 point through acupuncture and acupressure for the relief of chemotherapy-induced nausea and vomiting. I'm Michelle Kinsler.
And I'm Amanda Kruse. Today's topic sounds promising, Michelle.
Indeed it does.
For those of you fighting those cancer cells out there, you've probably developed a love-hate relationship with your chemotherapy and the side effects that often come along with it. Let's be honest, those probably don't fit into your life well. But there's some new research out there about stimulating a pressure point to alleviate these problems.
What is this magical pressure point, Amanda?
The pericardium P6 is a commonly used pressure point to control nausea and vomiting. Basically, there's a spot about an inch to 4 inches down from your wrist. If you could lift your hand, it's about right there. And you could put a little commonly associated with chemotherapy. A little bit of pressure on one spot can help all these things. Well,
I was wondering.
I was too. And so we called Dr. Shen, our good friend, and he's going to be with us later in the show sharing some of his research. So we're going to welcome Dr. Shen now to shine a little light on this subject.
Thank you for being here with us, Dr. Shen. So, how exactly does this chemotherapy bring out these awful side effects?
Well, chemotherapy causes the release of several chemicals, like serotonin in the small intestines. Messages go through the brain, activating the center response for nausea and vomiting. It's a major side effect of oncology treatment despite the recent advance in pharmaceutical management. There are three pathways involving, which is dopamine receptors, chemoreceptor trigger zone in the brain, and vestibular dysfunction.
Wow, that was some good information. Now, what exactly is the difference between acupuncture and acupressure?
Acupuncture makes use of thin needles while addressing health concerns. Acupressure does not break the skin. Both are central on touching meridians, which carries energy of qi through the person's body.
Okay, now where did this originate from?
These techniques are among the oldest healing practices in the world. As a part of traditional Chinese medicine, the stimulation of the P6 aimed to restore them and maintain health.
Well, thank you, Dr. Shen. We can't wait to hear about your research later in the show. Wow, Dr. Shen sure did have a lot of good information.
It sounded scientific and expensive.
Well, actually, first treatment runs about $75 to $100 and $50 for the follow-up.
That's cost less than what I pay the girl to walk my dog.
Well, and actually, most insurance companies cover it, so you will be able to walk your dog.
And have some extra cash. Now, with all this, we don't have to pay for it, our insurance companies might, I still might have some extra pocket change. How often do people utilize this?
Well, acupuncture and acupressure is very common. About 8.2 million United States adults have used this practice, and 2.1 million have used it in the last year.
Millions. Now, is it different from places around the world, or is it just a U.S. thing?
Well, it is commonly used all across the world, and it originated from China, Japan, and Korea.
That's great.
And now a word from our sponsor. When we return, we will have some studies to show you more information. Amanda!
Hey Michelle, how are you?
I'm great. How are you?
A little sweaty, a little sweaty.
Look at those snazzy bands you have on. What are those?
These are my AccuBands.
AccuBands?
Yeah, they help control my nausea and vomiting because of my chemotherapy.
Oh, wow.
Yeah, they're stylish.
No nausea?
No vomiting.
And look
hot.
Welcome back to CAM-TV. Our first study that we'd like to share with you today talks about the acupuncture used to alleviate chemotherapy-induced nausea and vomiting in pediatric oncology patients. Dr. Gottschling did this study for us, and there were 23 patients. Their average age was 13 years, and they were all receiving highly emetogenic chemotherapy for treatment with solid malignant tumors. The point of the study was to investigate whether acupuncture reduces the need for antiemetic medication during these times, and we will talk about what we found. Participants were randomly separated to receive acupuncture treatment during this time. The main outcome measure was to reduce the amount of medication used, with the second outcome measure being to reduce the amount of vomiting that happened during a specified period of time. 46 chemotherapy courses, with or without acupuncture, were compared. We found that the need for rescue antiemetic medication was significantly lower in acupuncture courses compared to control courses. There was pain from some of the needling, but no other side effects were reported, and patients' acceptance of acupuncture was very high. Acupuncture as applied here seems to be effective in preventing nausea and vomiting in pediatric cancer patients. Welcome back. We would like to introduce Dr. Shen again to our show to talk about his research with chemotherapy-induced nausea and vomiting.
Hi, I'll be talking about electroacupuncture for controlling of chemotherapy-induced emesis. Because high doses of chemotherapy poses considerable challenges to emesis management. Although prior studies suggest that acupuncture may reduce nausea and emesis, it is unclear whether such benefit comes from the non-specific effects of attention and clinician-patient interaction. The study design was done in a 3-arm parallel group randomized control with a 5-day study period and a 9-day follow-up, which was done at an oncology center at a university medical center. The test was done on 104 women with a mean age of 46 years with high-risk breast cancer. The objective was to compare the effectiveness of electroacupuncture versus minimal needling and a mock electric stimulation of antiemetic medication alone in controlling emesis among patients undergoing a highly emetogenic chemotherapy regimen. The intervention was 37 patients were randomly assigned to receive low-frequency electroacupuncture at classic antiemetic acupuncture points once daily for 5 days. 33 patients received minimal needling at a control point with a mock electrostimulation on the same schedule. 34 received no adjunct needling. All patients received concurrent triple antiemetic pharmacotherapy at a high-dose chemotherapy. The total number of emesis episodes occurring during the 5-day study period and the proportion of emesis-free days were compared among the 3 groups. The outcome was the number of emesis episodes occurring during the 5-day was lower for the patients receiving electroacupuncture compared with those receiving minimal needling or pharmacotherapy alone. The electroacupuncture group has fewer episodes of emesis than the minimal needling group, whereas the minimal needling group had fewer episodes of emesis than the antiemetic pharmacotherapy alone group. The difference among groups were not significant during the 9 days follow-up period. With this, the conclusion was patient with breast cancer receiving high-dose chemotherapy adjunct electroacupuncture was more effective in controlling emesis than minimal needling or antiemetic pharmacotherapy alone, although the observed effects has limited duration. And now we'll take a quick commercial break.
Welcome back, viewers. The last study we will be featuring on CAM TV today is the Acupressure for Chemotherapy-Induced Nausea and Vomiting, a randomized clinical trial by Suzanne Dibble. The purpose of this study was to compare the differences in chemotherapy-induced nausea and vomiting among 3 groups of women undergoing chemotherapy for breast cancer. The study included 160 women on average age of 49, beginning their 2nd or 3rd cycle of chemotherapy. The women were reported to have nausea intensity scores of previous chemotherapy of at least a 3, which was moderate, on the Morrow Assessment of Nausea and Emesis, measuring the worst nausea. The women were randomized to one of 3 groups: acupressure for the P6 point, acupressure of the S13 point, which was the placebo, and the usual care only. Subjects in the acupressure group were taught to apply acupressure, and participants were instructed to find a quiet place each morning to perform the acupressure to both points using their thumb on the other side of their hand, in which they held it for about 3 minutes. During the day, participants in the acupuncture group were encouraged to do this as whenever necessary, no matter where they were. Nausea can make the acupressure point at P6 tender to the touch, so they were supposed to hold it there until it was no longer tender, and that was when the treatment was complete. The study lasted 21 days, in which all subjects were to fill out a log containing measurements of their nausea and vomiting, and record the methods that they used to control these symptoms. All women did receive antiemetic therapy as well, that was prescribed by their physicians. The results are in, and for the day 1 acute nausea and vomiting, there was no difference between the 3 treatment groups. However, for the delayed emesis, days 2 through 11, the decline in emesis was greater for the P6 acupressure point than the placebo group and the usual care group. Delayed nausea declined greater for women in the acupressure groups than for the usual care group. However, there was no difference between the placebo and the P6 pressure point. The results in the data suggest that digital acupressure at P6 is useful adjunct to pharmaceutical intervention for delayed nausea and vomiting, most useful when the nausea was mild.
Hello again. In conclusion to our segment today, we'd like to bring together all of the research and findings that we've discussed.
Overall, the evidence for stimulation of P6 point for alleviating chemotherapy-induced nausea and vomiting, we decided that the evidence for the positive side effects were fair, with 2 studies that needed a placebo.
Now, it seems like when we were going through all of these studies, there really didn't seem to be many side effects. Like, one of the side effects was deep relaxation, and I just feel like that's not a bad thing.
True. There usually is not very many side effects, and if they do occur, they usually include changes in appetite, sleep, bowel or urination patterns, or emotional state may be triggered.
I think I'd rather not throw up.
However, these are indications that the acupuncture is working.
So I want to pee more to know that my acupuncture is making me vomit less.
True.
This is great. This is a gem.
That is it for this edition of CAM TV. We'd like to conclude with the following message.
The stimulation of the P6 point can eliminate chemotherapy-induced nausea and vomiting and is usually used in conjunction with other medications.
That's quite the health recommendation.
Thank you.
We'll see you guys here later.